Okay.
1, 2, 3.
Okay. A look into Alzheimer's disease. Imagine waking up and not remembering how to do previously learned tasks such as bathing yourself. This is just a small effect that Alzheimer's disease has on the brain. My grandmother was diagnosed with Alzheimer's disease 5 years ago, which sparked my interest in the disease. This disease is so widespread among the population and there is no known treatment for it yet. Today I'm going to share with you what I've discovered about Alzheimer's disease, including the causes, diagnosis, and available treatments. Alzheimer's disease is common among a lot of people, but it's very hard to research. The causes are not yet known, but there's ongoing research for underlying causes. Alzheimer's disease is categorized into familial and sporadic onset. Familial has a cause that is linked to heredity, which is associated further with early onset symptoms. Defects in genes in chromosomes 1, 14, and 21 are linked to familial Alzheimer's because of their cause of abnormal protein production. An Understanding Alzheimer's Disease, written by scientists Neil R. Cutler and John J. Schrammick in 1997, it is likely that all types of Alzheimer's disease have an hereditary component, but the extent to it develops the person's risk of the disease depends on the type of Alzheimer's it is. Sporadic Alzheimer's is linked to aging, which is typically after the age of 65. It is also the most common type of Alzheimer's. During aging, the neurons in your brain either shrink or die, which lose their ability to maintain function. Other risk factors include head trauma, brain lesions, or possible environmental factors. According to scientist John C. Stuckey, who wrote Alzheimer's disease in the International Encyclopedia of Marriage and Family, accessed on February 24, 2019, ongoing research is being done to provide reasons why these brain defects form Alzheimer's in some people and not all. Now that we've covered some of the causes, we can look at the diagnosis of this disease. Alzheimer's presents itself as dementia, but doctors have to look further into the symptoms that they have. Right now, there's no specific test that determines definitive Alzheimer's disease. Physicians must complete a full medical history, mental status exam, physical and neurological exams, and neuropsychology tests in order to have a high rate of accuracy of the diagnosis. If diagnosed, they will be diagnosed into probable or possible Alzheimer's disease. Probable Alzheimer's disease indicates that the symptoms shown are most likely Alzheimer's because the physicians have been able to eliminate other causes of dementia. Possible Alzheimer's disease is that likely Alzheimer's disease is the cause of dementia, but other disorders that can affect dementia are present and are most likely it. The key to diagnosis is early diagnosis. In the article Alzheimer's Dementias, an Opposing Viewpoints collection, Gale 2015, diagnosing Alzheimer's disease early makes it possible for providers to initiate early treatment to help the possible slowing of the disease. This would enable family members to educate themselves on the disease and prepare for future living arrangements. These would be things such as nursing home care or in-home care when possible. As we can see, the diagnosis of the disease is one of the trickiest parts, and which would lead to possible treatments. The financial burden is really related to Alzheimer's because of the key that it takes on family members. There are currently no proven medications to slow the progression of the disease. However, cholinesterase inhibitors is a class of drugs that has seen to improvements when it is administered to Alzheimer's disease patients. This type of drug targets the neurotransmitters that occur later in the disease, and when applied to Alzheimer's disease patients, it produced modest results, but it was not shown the ability to significantly prevent the progression of the disease. Also, regular physical, mental, and social activity can help a person's risk of getting Alzheimer's disease lower, and then also if the patient already has Alzheimer's disease, it can help them function better with the disease. In a Caregiver Homes article titled Dementia Care, Cost by State, Overview of Costs, Types of Dementia Care, and Cost of Dementia Care by State, written by researchist Angela Stringfellow in June 2018, dementia care costs in the U.S. is more expensive in terms of medical costs over the 5-year span of in and out-of-pocket expenses than that of heart disease or cancer. Alzheimer's disease is one of the top 10 deaths in the United States that cannot be prevented, slowed, or cured. Families are then forced to choose their level of treatment and care based on the progression of their patient. It is more expensive as it progresses later. In conclusion, Alzheimer's disease has become monumental in the field of healthcare, which is why today I've covered the causes, diagnoses, and treatments of the disease. In 2018, 5.7 million Americans live with Alzheimer's disease. There's so little known about this disease, but it affects so many, including my grandmother. Alzheimer's disease affects not only the patient, but the family members that have to deal with it. Becoming educated on this topic will help you be better in your possible future with it. Thank you.